Time being 6:10, I am going to call the Board of Health meeting to order. All members are present, as well as our Director of Public Health, Marty Golightly. Our first item on the agenda is our announcements from the Health Department, and I'm going to turn that over to Marty.
Okay, I have a quick share screen. We're going to go through a couple things so I can make sure that everybody is aware of what's going on before you make any decisions. Never works the first time, does it?
It actually did for me. I could see your, it looked like it was the numbers you have in the link, but it was on a PowerPoint.
Yep, hang on, stand by. Sorry about that.
Marty, I can see your slide 1 for your screen share.
Okay, great. So we're just going to go through it this way, if you don't mind, because you can see the actual where I got it from down at the bottom. So currently we are at 564 cases. That is up from our last meeting on the 20th. We had about 107. This is a statewide and a countrywide increase in cases. It is by far our largest total of cases and case positivity that we have seen yet. Average age is 33. Next slide is the demographics, a little bit of a breakdown. Everybody can see that. I'm not seeing it the right way. Sorry. There we go. All right. Everybody got that? You can see that. You can put that. There's our cases based on the percentages of fully vaccinated, under vaccinated, and not vaccinated. Sorry about that. 15% were fully vaccinated. Fully vaccinated, the definition of the change to include the booster now for those who are eligible. And under vaccinated means that they are eligible for the booster and have not gotten it. There's our school dashboard, which hasn't been updated as of yet. I know that they're working on that right now. The number of students positive and actively in quarantine across there are up there. And that number probably will increase as they update this data later on this week, or when they do that. I think they're doing it on Thursdays or Fridays. I can't remember. Sorry. This is a Friday. And have you heard the school will extend its mask mandate through the end of February? And that announcement was official as of today. This just came out at 5 o'clock. We had 60,000, almost 61,000 cases over the 3-day weekend, bearing in mind, was a 3-day weekend for most people, that Friday, most of the testing sites were closed or they were operating in a limited capacity, and that's still over 20,000 cases, or excuse me, 20,000 cases per day over the 3 days. And that's massive. There's the 4-day, or excuse me, there's a breakdown of trends over the last 3 days. The case, or excuse me, over the history. That's cases, that's testing, hospitalizations, and death. And you can see that everything is on the uptick. We are still climbing. And I don't think it will even plateau until the middle of January. Unlikely to be any sooner than that. And the University of Texas does a pretty good job of breaking that down. And I can send that to everybody. There's our hospitalizations. If you can't see, the hospitalizations are also increasing. And they're already increasing, even though that this is usually a 2-week lag. We call it a lagging indicator. So the more cases we get, the more hospitalizations we're going to have. And we will quickly overwhelm our ability to treat patients. Even if Omicron appears to be milder, it does not take a lot to overwhelm the healthcare system. Speaking of that, this is called the circuit breaker dashboard. This is what do we do? How do we get how close we are to that that capacity at our hospitals? And you can see that Massachusetts specifically Plymouth County, we are at capacity and we are forecasted to exceed capacity. And a lot of the country is. All of those states are color coded for forecasting to exceed, at capacity or has capacity, and a number. There's our deaths, which are also increasing. You can look up Plymouth County specific deaths on this too. And again, these are all lagging indicators, so we won't know the true metric for this until well past the peak of cases. I just wanted to show the rest of the world is also in this current upward trend. It is increasing exponentially all over the world. And I wanted to show this because historically, since the start of this, the US has fallen a little bit behind what happens in Europe. The European Union is usually our canary in the coal mine and our future predictor for when we should be at our peak and cases should start to fall off, and they are still on the uptick. This is that University of Texas that I was talking about. The specific best case, worst case scenarios. This is a by hospitalizations, by cases, and by mortality. And you can read the best case and worst case scenarios. Best case, we're still at about 1,700s per death. Now that's nationwide, obviously. And the University of Texas did this forecasting, and I can send everybody the data that they based it on if you really want it. I'll send the PowerPoint slides to everybody after this too. But that worst case scenario is pretty scary for public health. 43,200 people will be hospitalized per day. That would call for some drastic measures in our healthcare system. That is our cases and fully vaccinated in Massachusetts. Of the cases of our fully vaccinated people, they were only made up 3.5%. Hospitalizations among our vaccinated residents is only at less than 0.1%. And our deaths are less than, or it's 0.02%. So that's making a pretty good case for getting vaccinated right there. Overall, this is from the CDC, and this is just in October, and you can see that the dark blue line is our fully vaccinated with booster doses, and this is cases, and those cases stay really, really low. Unvaccinated obviously are high, and they continue to climb. And that fully vaccinated without the booster, they're still getting it, but not nearly as bad as the unvaccinated. This is deaths. Unvaccinated are still way out ahead of the other two, fully vaccinated and vaccinated without the booster. And in October, like it says, 10 times the risk of getting and 20 times the risk of dying from COVID-19. There is who can get a booster shot. I wanted to leave that on screen, so I hope you indulge me for a few minutes. So if people are concerned, they can take a screenshot of that or just kind of figure out where their eligibility lies. And I will discuss booster shots a lot. We are still offering them. We will be offering them for the latest age groups. We're going to try to do as many as we can in town hall, and we'll do a few home visits for the needy. If you have any problems, you can always give us a call. So that's who's eligible for the booster. There is our website, abingtonma.gov/health department. We have just built-in links to click on for the vaccination for kids and the vaccinations for the boosters. Just click on that hyperlink right there, and it will take you to an appointment making platform. You can make your appointment, and if you have any problem with that, there's our phone number, 781-982-2119. Give us a call. We will do our best. If you're having some electronics or you're not too great with the computer, we'll do our best to help you, walk you through it, or we'll just make it for you. And that's all I got.
Thank you, Marty. Anybody from the board have questions for Marty about this? I want to keep in mind that we do have an agenda item to talk about COVID-19 safety measures tonight. But I'm sure if there's anything that Marty just mentioned we want to ask questions about now, we can do so. So, anybody in the board have questions? Christina?
Marty, something that I just wanted some clarification on is like how we're considering people fully vaccinated. I think what you said is it now includes people that have had the booster shot,
It is.
but is that just, does that take into consideration people that might have just gotten like their second dose, but they're not eligible for the booster shot?
Yes. So the definition of a fully vaccinated, and this is from DPH and CDC, is it has been more than 6 months or 5 months in some cases from your second shot,
Okay,
and you are eligible for the booster. You have gotten the booster. That makes you fully vaccinated. If it has been less than 6 months or
Mhm.
5 months in some cases, and you completed a 2-shot series, you are still considered fully vaccinated until you become eligible for that booster time.
okay, I understand. And that's exactly what I was asking. Thank you so much, sir.
Welcome.
Okay, I got a couple of questions. Is that University of Texas graph that you provided to us the only information you have that makes you think that this is only going to get worse between now and mid-January? You said, I believe you used the word plateau.
No, I think so. I've been following the Boston wastewater studies. I don't know if you're aware of that. There's the amount of COVID-19 that is present in our wastewaters. And usually that has been, historically, at least for the last 2 years, that has been a pretty good indicator of where we're at. And when that starts to decline, cases usually start to decline from anywhere between 4 and 10 days after that. And right now it's on a couple day decline. So extrapolating backwards from 4 to 10 days, we might be close to a peak, but that would still be around the middle of January.
Okay, and that graph you showed with the percentages of, vaccinated individuals getting cases, hospitalizations, and death, is that for, those numbers including the entire pandemic, or from the time that vaccination came out to now?
Are you talking about the Massachusetts specific one?
Correct.
That is for the entirety of the pandemic.
Okay, because that definitely waters down the numbers, as there was no vaccination available for a year.
So we don't start tracking that data until people become vaccinated. Like, I can't tell you who has or has not gotten COVID if they're vaccinated until after they're vaccinated.
Yes.
So for the entirety of the pandemic, since the vaccine has been available.
Those numbers are the day the vaccine became available to now are those numbers. There's
Right. I can definitely double check that and get back to you tomorrow, but as I understand it, yes.
Okay.
So I can only tell you if the vaccine is preventing cases since the vaccine has become available. That's just obvious.
You can't tell if the vaccine is preventing cases?
No, I can't tell you how much the vaccine is preventing cases since the start of the vaccination. Yeah. You understand what I'm saying? Like,
yes,
we don't start counting vaccinated people until we get some.
Okay. You broke up, so I couldn't hear you for
no problem.
And then I just want to ask you, your vaccine clinics at the town hall on this past Tuesday, what time did that clinic end?
I couldn't tell you off the top of my head. I'd have to look back and see when.
Okay, because I was in there at 4 o'clock getting some building permits. Yeah, you can't. And that's a Sharps container that was left on the table there with nobody in the room.
Okay, I don't understand your point.
Why was there a Sharps container just left out?
We might have still been doing shots. And we're still in the building.
Okay,
Andrew, if you're concerned with Marty with that, I would suggest emailing him directly and talking about that. That's not a discussion for us to have at this meeting.
Okay.
If you have a problem with our safety protocols, I can send you I don't know, my God, how many times we've done a safety brief before this and had safety discussions before this, safety discussions for every single one of our shot clinics that we've done successfully and safely at the high school, the middle school, Beaverbrook, Frollo, the other school, the senior center, and all around without an incident, without a single incident for over a year now. So if a Sharps container, one Sharps container was left on the table. It's probably because we were still there working. And we do safety briefs before every single evolution that we've ever done. And we haven't had a single incident. So we will continue to do shots as safely as we can, as much and as often as we can. And if you have an issue with that,
I'm not
you
asking
can
you to
happily
stop
come
the
down
clock.
here and we can discuss safety all day long because I'm an expert at it and that's what I'm good at. And you can come on down.
Sharps out is not safe. I'm not asking you to stop
Okay.
providing vaccinations, Marty. I'm
Okay.
asking you, why is there?
We're not having this discussion
What
at the
if a
meeting
child
tonight,
came in
please
with
and
their
thank
If you
you.
would like to discuss it,
We're not, hey,
if you'd like to discuss it, you can come down to the office and I'll show you why, or maybe explain it to you a little better.
listen, we have no purview over that with regards to the health department, but if you do have concerns, we need to take this outside of this meeting. It's not going to be discussed tonight any further. So we're going to move on to our next agenda item, please and thank you, which is for regulation review of the body art regulations, section number 2. I remember at our last meeting, we discussed about bringing in our body art practitioners to have this discussion with. We ended our last meeting early, so we didn't get a chance to have that conversation, and I'm not sure that they were invited tonight either, in thinking of that. So we probably want to keep that in mind moving forward and how we structure the rest of this discussion. Christina, you've been leading the charge on this. I don't mind letting you take over and kind of explain what your thought process was for this section. We can go from there.
Well, as far as trying to incorporate our currently licensed body art practitioners in the town of Abington, I think if I recall correctly, where we landed on that topic was my original stance was trying to move through it and then bring them up at a later point. But we had feedback from the board during discussion to also include them on this topic of definitions. So I believe, if I'm remembering correctly, Aaron, we had a board member suggesting it might be the best person to invite them. So me speaking for myself, I'm happy to kind of share what we have and move forward without them. I also recognize that unless someone knows something different, this is not a timely regulation. I would eventually like to get it done, but it's not like there's a crisis happening that has to move fast. So depending on how everyone else on the board feels, and this really is a discussion, we could formally invite them to our next one, Aaron, and I would be fine with that because that's what the board had vocalized previously.
Melissa, did you have something you wanted to say? Okay.
Thank you. Yeah, Aaron, if I may, I think it would be appropriate to table the conversation until we appropriately invite the party. That's what we had discussed at our last meeting, that we would include them in the discussion. So if they weren't invited this meeting, I would recommend that we table this discussion until the next meeting where they're invited.
A lot of this agenda planning was let's try and get to what we missed before, and I think that just got lost in translation. So I'd agree with Melissa. Let's do what we originally intended to do. Kevin, did you have something you want to say?
No, I just think that's appropriate. I think when you are setting up any new regulations, it's important to have the people that it's going to affect and the businesses that it's going to affect to have their input.
And if that's where the board is, before we end and move on to the next topic, Aaron, I would like to screen share kind of like the milestones on how this is going to sort of roll out, if that's okay, just so the whole board knows where we're moving.
Sure, that's fine. And if we are going to table this discussion, I probably want to take a vote on that. Just remember, we're going to need to do a roll call vote on virtual, but we can do that after viewing this if you like, Christina.
If that's okay, just so we're able to table it, but I can share like the logistics.
Yep.
So if everyone will bear with me, I'm going to attempt to just share like really quick how we're moving forward, because I kind of feel like you take 10 seconds to do this on the front end. It saves us hours and hours on the back end. All right, brace yourself, everyone. I'm attempting to screen share on a Facebook Live.
There we go.
Okay, we can see us all. So reason I wanted to screen share is this is on a Google Sheet. It does have 2 tabs. One tab I just wanted to share was the workflow. This is how I have preliminary set this up, how we're kind of going to move forward in just phases. And I just wanted to be clear like where we're at and how we're moving forward and how we're going to include. So like phase 1 is rough draft creation. That's what we're up to now. The goal is to get through the entire thing as a rough draft. That's not like a vote. That's like, okay, we all agree as a board, we've got consensus on a rough draft. Phase 2 is going to be the body art practitioner and health department review. That's in addition to them weighing in on the definitions for section 2. So like after we get through the whole thing, we're going to give this to both the health department formally and the body art practitioners. So they have time to look at it completely, invite them back, get their feedback, take their feedback and do a final draft, get this out to our legal counsel, and then finally take a board vote. So that's as I proceed the steps. The steps in the workflow can change, but I just want to be clear that if you miss something on January 10th, there's going to be ample opportunities as we move through this if you learn new information to catch it. So it's not like you missed the boat. And that's just kind of what I wanted to share. The other thing is on the rough draft edits, I only have up to section 2. I just want to recognize there's things outside of this that have been discussed already that I'm going to continue to incorporate when we move past this topic 2. Those include the health department, Marty Golightly, suggested language about CRM 480 being included. Mr. King suggested a topic about stud gun usage, and Mrs. Pond suggested about record keeping moving from 3-year to 7-year and removing the terminology about physical disability. You won't see them on this because this is just section 2, but I do have that noted. And as we move forward, I'm going to be sure to capture that. And that's kind of it. So let me end the screen share. And if I drop off this call, y'all can laugh at me. Stop share. Okay, that's all I have. I just wanted to come to share logistics before we tabled further discussion, and I'm open to feedback as well.
Thank you, Christina. Anybody have any questions for Christina or about this at all?
I would like to recommend and request, if at all possible, could we wrap this up? I know there's a lot of work to be done, but if we could wrap it up before the end of this board. There's an election coming up and we end as a committee in April. So if we could take care of this and also the tobacco regulation before April, I'd greatly appreciate that.
Yeah, and I agree with Melissa. I think we should try and get this taken care of. Tobacco, I believe we're still waiting on DJ Wilson to get back to us, which is why we haven't talked about it. So once we get those back, we can have that discussion. But I think we need to send a follow-up and figure out where we are on that one. Much agreed on that. We'll get a request out to have our body art practitioners at our next meeting. It might be easier to get them on Zoom too, as well as coming to an in-person meeting on a Monday night as well. So I think that'll be a good option.
And Aaron, just for clarity, we're looking at their feedback on the definition 2 section, just so we can try to be concise. If they know there's other things like they're trying to add it, I just don't want to get too bogged down because we won't get it done before this board's, what do you call it? This board's term. So, okay.
Yeah, this cycle, something.
Cycle, yeah, thank you.
Right. Do I have a motion to table this?
Motion.
I have a motion from Melissa to table it. Second from Christina. Any discussion? All those in favor? Oh yeah, we got to do roll call. Yep. Melissa, how do you vote?
Yes.
Kevin?
Yep.
Andrew?
Yep.
Christina?
Yes.
And I vote yes. The motion passes unanimously. Okay. Excuse me. On to our new business. The first item is our COVID-19 safety measures. December 6th, we enacted a face mask advisory that is still in place. We could at this time decide to do rescind or continue or make any other motion relative thereto. What is the discussion from the board on the matter? And I don't know if Marty's still there for questions or anything related to this. Oh, okay, great, thank you. So I'll open that discussion up to the board.
I'd like to hear from Marty. Do you have any recommendations for what we should do?
Yeah, Marty.
It's really difficult to make a strong recommendation because I'm not exactly sure how it would be enforced throughout the town. It would be better if the state made any type of mandate simply because they have the resources to enforce it, whereas we really don't. Do I think making masks mandatory in Abington would bring down cases? Yeah, I do. I just can't. I couldn't enforce it, and I don't know what kind of burden it would be on, especially on larger businesses in town. Would would the numbers be significant enough to justify any loss? Or I honestly don't know the answer to those questions. I wish I did. Would it bring down numbers? Probably. But with the limited resources that I have, they are better utilized doing as many vaccinations, doing as many homebound vaccinations and boosters as we can. And working with the schools to host more clinics to get those numbers high. And that's kind of all I got. I think that's probably not much of a recommendation, but with the limited resources that we have, I think we should be focused on further vaccinations, education, and those kind of things. I hope that answers your question, Melissa, but I know it's not really.
I appreciate that. Are there any other kinds of advisories or mandates that we could make that could make a difference? Like anything like advisories for work from home? Like how many offices are there in Abington, including like town hall, that we could recommend or make an advisory that offices switch to like where remote work?
We could certainly make, we could certainly easily write up something recommending remote work where at all possible. We could probably, you know, I think that might be the biggest one, recommending remote work as much as possible, remote meetings, any events, postponing or making it virtual. I'm sure would help.
Christina?
So the things that frighten me, honestly, is this idea of the healthcare system being overwhelmed. Whether the examples I've read are anecdotal or not, I have like an emotional reaction to hearing about large waiting lines, people afraid of not getting care for normal healthcare issues because the resources and the people are very stressed. I don't know if the information that our board is privy to is really top of the mind for all of our residents in Abington. I know that we have a spreadsheet. I know that we do a Board of Health meeting, but to be honest, it's really easy after all these years. It's just become kind of white noise, even to myself. It's like, I'm tired of wearing a mask in a grocery store. Our advisory went out. I saw a sign, I think on like when you turn into the school, you know, health department maybe recommends wear a mask. I might have a location. That's kind of it. I don't know what resources are, but I think I would feel better having ramped up the education to the town, how serious the healthcare system is right now, and let it be known to people that, you know, they need to be very proactive about their health. Maybe resources on where they contact if they can't get an appointment with their doctor. I hesitate to recommend this because I think it's only private companies do that, but utilizing like telemedicine if it's possible. If our town employees could perhaps get a recommendation, the Board of Health to our town manager for him to consider allowing people to go remote. I just don't think this is top of the mind. If we can't enforce a mask mandate, then there's no discussion to be had there. I mean, it's not going to matter, but I would hope we'd be able to do more on the communication side to help inform our residents so they're taking precautions. So I just feel like we're not doing enough. I feel like maybe I'm not doing enough. I don't really have a lot of great ideas other than what I've said on what we can do. So that's my point for sake of discussion.
On the note of communication, was our health department Facebook page taken down, or is that still, I couldn't find it when I searched for it on Facebook?
It's back up. We've been putting out educational materials all day and links to make appointments.
So if it's back up, how long was it down?
A few days while we figured it out, whether or not we can keep comments disabled.
Why are we trying to keep comments disabled?
Advice from attorneys that it was best practice.
I don't think Facebook is enough. I mean, you have to be subscribed to Facebook. And I'm sorry, I know this might be sounding really critical to those of us who love Facebook, but if it's just white noise to you and you're not on Facebook, I don't know people going about their business realize how serious this is. I'm sorry, social media is a private company that, I mean, Marty, I know you don't want to get out there and dance on TikTok, but is there other things that we can
If it
do?
lowered the case or death rate, I would. I mean, we can also start doing, we did a series of videos mostly for education and discuss this. And we haven't done them since the summertime when our cases are really low. I can talk to Kevin at Abington Cam. I know he'd be willing to do the health department roundtables again, where we can discuss that. At least they can go up on the Access TV. And I know the ones where we discuss efficacy and safety of the vaccine have been running on there with some frequency. We have the electronic boards. We've been putting stuff up there.
What
and-
electronic boards do we have? I know we have the one outside by the leading to the library, but
We only have access to that one. The rest of them during the initial, it feels like forever, 2 years ago, when we asked permission and they were gracious enough to let us use them. Like the one at the bowling alley, the one at, can't remember the other one. There was a few.
Marty, maybe we could, like the highway has those signs, like when they do road constructions. I don't know if they have any signs. Maybe we could put them at some strategic locations in
Yeah.
town.
It's actually the police have that. Are you talking about the big board? And we've used
Yeah,
it
the
for,
boards, yeah.
we've used it for our shot clinics when we're directing traffic and telling people where to go and that kind of thing.
Right.
I can ask the
Yeah.
chief if we can use it as an educational board.
Mhm.
I'll make a
I
note.
believe Whitman is doing that as well. Might not be a bad idea.
the people, I mean, the thing about the education videos, people are going about their lives like normal, which is kind of what we want to do. We know we're in a pandemic, but most of us have the desire to go about our lives as normal. You've got to log into YouTube and find the video and watch it. And if you're already doing that, you're probably not the person we need to reach. I like the Whitman sign, Aaron. I think you brought that up just now because I saw that as well. But I think signage, like Kevin, you're suggesting at the places of common usage, like the grocery stores, someone walking into a grocery store that's not on Facebook, they're kind of the ones that need to get that warning, I think, to let them know that these numbers are going up. So
I do think we should advise that all public meetings go to remote. I mean, we have the capability. And there's no reason for, any board to meet in public. They've had a year experience, almost 2 years experience now, managing without, managing on Zoom or, managing over the internet. So I think we should advise all boards to do that. And even, public places, I think we need to lead by example. And, if you're at town hall, you should be wearing masks in public places.
yeah, makes sense to me as well. Even town employees, if town employees can, I mean, I think that's under the purview of the town manager, we can make recommendations, but if town employees have the ability to work remote, I mean, can the Board of Health, maybe we can make a recommendation to that? Oh, I'm sorry, Marty, go ahead, please, sir.
I'm sorry. I've talked to the town manager, and the vast majority of town employees, at least in town hall, are already wearing masks, and the library is as well, and obviously the school.
Good. Well, that's good.
Working in the building, and is it open to the public still?
The library and town hall are still open to the public.
I personally believe we should be in-person meetings wherever possible. I understand some other people feel differently. As far as COVID safety measures, Marty, one of your safety measures is tracking how COVID is spread. And I had a question from a resident a couple of weeks ago that I was not able to ask you at the last meeting. Do you have any involvement with the testing in the schools? Like, do you get that data just given to you? How does that work?
The testing for the test and stay, or the testing when we find out that there's a PCR coming through Maven and we send the address to verify whether or not a student lives at that address?
The test
So
and stay.
there's a couple different factors when we talk about tests at school. So the test and stay only, test and stay is tracked by the school nurses for what their purpose is to keep kids in school and out of school. We have limited, if not much, oversight or purview in that. That is strictly a DESI school nurse program. I have asked the Academic Public Health Coalition to come into town, and they should be here really soon to do some studies for us. And one of the things I've asked them to do is to run some data analytics on how successful or unsuccessful test and stay is at the school. And we will be coordinating that with the school nurses.
Are you provided with that data? The positive tests, the negative tests, are those included in the town-wide?
We talk to our tests data that we report is strictly PCRs from the state. Any test and stay student that tests positive, we ask them to go get a PCR confirmation test. What you see on our spreadsheet is only from the state's Maven access system, which reports PCR positive, meaning the data that we have might not be accurate to all of the cases in town. It could be significantly higher based on home tests, some of the other ways people are getting tests, and just not telling us, it could even be not significantly lower if we have college age students home for break. But it'll probably be significantly higher because we don't include antigen positives on that until they get a confirmatory PCR.
Yeah, it could also be a lot lower, whereas you just said that.
How can it be lower? We only report the numbers from the state's PCR database.
Exactly.
So it can't be lower, it can only be higher.
You're saying it doesn't take into effect the school's tests, right? It's just the stuff from the state, correct?
I think you may be misinterpreting what I'm saying here. The numbers that we report are the PCR molecular tests that we get confirmation from the laboratories for. So if someone takes a test and it's a PCR, we get an email or it's generated in our system for us to go in there and pull up. So we pull up those positive tests from a state database. The school, if they're doing school test and stay, will say after the fact, after they do the test and stay, if one of those kids is positive, they will ask them to go do a confirmation PCR test, which will then be reported to us. So the numbers could be significantly higher if someone's taken a CVS at-home test and has found that they are positive and decided to do the right thing and isolate for the time that they're required to isolate.
Okay, so negative tests, I think I got this now. Negative tests are not reported to you at all, and positive tests are only reported to you after they leave the school and go get a PCR test.
Tests are reported to the COVID liaison with my office, Sarah, and we will discuss it if it's needed, and we will ask them to go get a confirmatory PCR.
Okay, the resident reached out asking what the test and stay data was, how many kids are actually testing positive. And
yeah, I'd like to know historical trends on that, which is why I asked the Academic Public Health Board to come in, so we can get some epidemiological data to back up our decisions if we need to make different ones.
And then my only other question is, and you're gonna love it, what has Abington adopted the 5-day and 10-day isolation period that the CDC has come out with?
When we only will make changes when the state makes the changes. So we won't do anything that the state doesn't do, because that's our basic minimum requirements. If the state says they are adopting the CDC recommendations, that's what we in fact have to do. So our isolation times are based on that recommendation now and DPH guidance.
Okay, so my question is, how is the health department that has so strongly told me that they will not and can't track it when the state adopts the CDC recommendation for 5 days for asymptomatic people? How is the health department going to track that?
As best we can. There's a method to do that in Maven.
There's a method to do that. How?
In the system that the tests are reported to us, and we've put out as much data as we can. We've offered the isolation guidance, and we've given it. It's printed out. It's at the library. You can pick it up. You can pick it up at town hall. It's not unknown information at this point. If you don't know the isolation times and you test positive,
I'm not
let us
asking
know.
what the isolation time is. I know what the isolation time is. I'm asking for you, how is the health department going to track these when you told me at the last meeting that you couldn't call people to find out if they were asymptomatic or not?
No, we still can't do that.
How are you
It's
gonna
very
keep track
difficult to
of
call
their-
600 people, especially when some of them speak Portuguese and Vietnamese and Hindi and Farsi and a few other languages, not including, Haitian Creole. So no, we can't talk to every single patient on our 602 patients. If you want to come do some volunteer time, or if anybody in the board wants to come do some volunteer time and help us call patients, we certainly wouldn't tell you no to that. So no, we're not talking to every single patient, and we can't due to volume because we also
Okay,
have
so
to do other things. So
how are you gonna keep track of, say Christina tests positive but has no symptoms and
because
goes out.
symptoms don't matter if you test positive. We've already had
But the
this discussion.
CDC says I can leave in 5 days. And you're not gonna track any of that now?
We can't
Aaron, can
track
I
that
interrupt?
volume. I cannot explain this any more clearly or succinctly to you than I already have. I can give you all the information, but you got to look at it. And we are doing the best we can with the limited workforce that we have to make sure we're doing everything as safely as possible. I
I'd like to
can't
recognize
explain it.
Melissa, please, gentlemen.
Yeah, Melissa.
Thank you. Marty, is it true the state has recommended where to focus your attention as far as which calls to make? I believe it was the elderly or,
And schools.
can you clarify that? Yeah.
At schools. We're to focus our attention as best we can. And some towns, and we might be among them soon, aren't making any calls to any positive case. Our focus has to be on keeping students in school, reaching out to our elderly, vaccination, and boosters. And this is not new. This has been around for a few months now. When the
No,
CDC closed, we lost a lot of our capability to contact trace. And when I talked to the deputy director of the DPH system to complain about that, Jana Ferguson, on the phone several times, she said that the focus is now not going to be on contact tracing or speaking to positive patients because we're 2 years into this and they should be able to follow isolation guidelines that are readily available.
Thank you. I also want to follow up on your comment about the language and communications access. I believe the state has discontinued their support for the communications access. Is that true?
That is true, which is another reason we asked the academic health corps to come in. They have a lot of Haitian Creole and Portuguese speakers, so they can reach out to those communities too. I would like to use it primarily to educate for vaccination and boosters, but they can also make calls if we need them to make calls.
Okay. I also understand the school department has access to communications in Abington. Is there any way to collaborate with them to get the resources for the health department to make the contact tracing calls?
We do, and we have, if there's a necessity, we have had Sonia come on and make some phone calls for us.
Thank you.
Thank you, Marty. Thank you, Melissa. Any other discussion or motions from the board?
I'd like to make a motion. I'd like to make a motion to amend the current advisory to include the current healthcare system capacity status.
Second.
Can you clarify your motion for me? You're including that to advise that is a concern?
Yes, I'd like
Okay.
the advisory to communicate to our residents the current status that the healthcare systems are at, projected to be above capacity. I'd like our residents to be aware of that for their own planning.
Okay. So I have a motion from Christina to amend the current advisory to include the concerns about the hospital capacity, healthcare capacity, and that was seconded by Melissa. Do I have any further discussion on the motion?
Yeah, could somebody screen share that advisory? We had it up on the screen for all of 10 seconds. It doesn't give you much time to actually look at what the graphs and everything is saying. I'd like to be able to look at that, read that before.
Are you talking about the graphs with the data for the healthcare that Marty shared at the beginning?
Yes, that's correct.
Yeah, Marty, is that possible?
I will. I can email it to the board after the meeting too.
Okay, thank you.
Thank you.
If it's going to be that way where it's after the meeting, how can any of us or
He-
any board in any
he's-
town anywhere
He's going to share it now too. He's just telling us he'll email it to us afterwards as well.
That's the one you wanted?
Is that what we're gonna be adding in?
I can add in language that states that the healthcare system is at or near capacity or is forecasted to exceed capacity. I can add in our hospitalization data. I can add in the trend.
Could you bring up the slide that says that hospital capacity is at its capacity?
For this motion that I've made, I'm only asking about the current healthcare system capacity. We can, after this vote, I think it'd be okay to make another motion to add additional data points. I just don't want to bundle them into one. So we can vote like kind of in sequence.
No, I just want to be able to make an informed vote on your motion, Christina. I don't want to just not be able to see anything and blindly vote on it.
I was responding to Marty's comment, Andrew, about he was saying we can do hospitalizations. I was more responding to Marty that I'm not asking for hospitalization data as far as how many patients have been hospitalized, more about where the healthcare systems are at. So it wasn't at you, it was at him.
So to include our percent occupied and this kind of thing.
And where are these numbers coming from?
This one is from every source I use, I will cite, and you will see when you get the actual PowerPoint, and it's from down here. I have the, I'll send it to you from the circuit breaker website. Circuit breaker in this case indicating when they will need to basically use field hospitals or extend increase in access to hospital beds by some other method, National Guard, hospital ships, hospitals using churches, whatever the case may be.
Okay. Well, I thank you for holding up the meeting for that so I could actually see what we're talking about.
Any further discussion from the board?
I'm totally for, anything that we can do to strengthen the advisory and to, just get people to, understand the gravity of the situation. We've, obviously the cases have gone up 5 times since we last met 3 weeks ago. So, obviously it hasn't peaked as yet. So, anything we can do to strengthen the advisory to inform the public, I'm fine with.
Kevin. I will just say, we've as Kevin just said, we've really seen these cases increase, and if we can make this advisory as beefy as possible and really help, as Christina said, educate and make people understand that this is serious, and we really need to put a stop to it or slow it if we can. That's the objective here. That's what we want. We want this whole thing to be over. I don't think anybody wants to tell people to wear a mask or anything like that. It's just a condition of where we're at, and if we can get through this faster because of it, that's great. Do I hear any other discussion before we go to a roll call? Hearing none. Melissa, how do you vote?
Yes.
Christina?
Yes.
Kevin?
Yes.
Andrew?
Yep.
And I vote yes. The motion passes unanimously to include that wording to our advisory. Any further discussions on this agenda topic? Christina?
I'd like to make a motion. This will be my last one. I'd like to make a motion to amend the current advisory to include a strong recommendation to Abington businesses to consider, not mandate, consider a remote work option when possible. I do not want to say to my intention, so please feel welcome to discuss on phrasing. I do not want to tell businesses that they need to tell their employees to go remote. I would hope that businesses would strongly consider allowing their employees the option to go remote. So those employees that don't wish to, because they may want to be in the office, Andrew made a point earlier, as one of our Abington residents, that in-person works better for him. But for some employees, I just want to put that strong recommendation out that businesses, if able, would consider allowing their employees that option. I think a recommendation like this will also bring kind of focus onto what's going on in our town, because I think in addition to the last one, people will go, what's happening, and help them be informed. So that'll be my last motion for the day. So open for discussion, I guess.
I have a motion from Christina to include a strong recommendation amendment to our advisory. Do I have a second?
I'll second.
I have a second from Kevin. Any further discussion?
Could we amend it to also include, and I know Christina, you suggested maybe doing this in a series of recommendations, but just make a blanket statement about recommending social distancing, and as such, including remote meetings, remote work if possible, and
I
remote
believe I need a
events if possible.
I believe I need a motion to amend on that because the motion's already been made.
Melissa, are you making a motion to amend?
Motion to amend the motion?
I will second the motion to amend the motion.
I have a second to I have a motion from Melissa and a second from Christina to include the social distancing wording to the suggested motion. Do I have any discussion on the amendment? We need to vote on the amendment, then we can vote on the whole. All right, so we're voting on the amendment made by Melissa, and then we will vote on implementing it in the first place. So Melissa, how do you vote?
Yes.
Yes. Christina?
Yes.
Kevin?
Yes.
Andrew?
Yes.
And I vote yes. The motion is unanimous. The motion passes unanimously, excuse me. And now about adding that wording to the advisory. Do I have any discussion? I will say this. I am in agreement with the fact that that should happen, that it should be recommended that people work from home. I am a little concerned in using the word strongly recommended there. I feel like we can stick with advise here rather than strongly recommend. Not that it changes the importance or gravity, and as I've said before, I believe that's important. I'm just concerned with that wording to sound. I don't want to overstep where we shouldn't. These are private businesses also. We need to keep that in mind.
I think that's fair. I think that's more than fair, Aaron. I think, an advisory from the Board of Health is supposed to have a severe, people should pay attention to it. And to say strongly recommends, I think an advisory to that point, I think is fair.
So I am going to make one more amendment.
Amendment to the amendment.
Christina's motion to the amended motion that we just swap out strongly recommended for advised. Do I have a second?
I second your amendment to the motion.
Thank you, Christina. I know this is crazy, but I want to do things the right way. Do I have any discussion?
No.
Roll call one last time, then we'll vote on it. Melissa?
Yes.
You guys lost me a while ago. Is this Melissa's motion or Christina's motion?
This is my motion to amend the amendment to just say advises rather than strongly recommends.
So we're voting on whether to add in.
We're voting to
recommend
swap
or
out the word strongly recommends from Christina's motion to the Board of Health advises.
Okay.
Christina?
Yes.
Kevin?
Yes.
Andrew?
Yeah.
Okay, that motion passes unanimously. Okay, we can finally vote on this last one. I will take the last roll call here. Melissa?
Yes.
Christina?
Yes.
Kevin?
Yes.
Andrew?
Yeah.
I vote yes as well. The motion passes unanimously. We will add that into our advisory. Okay.
Aaron, thank you for reading Robert's Rules of Order today.
I'd rather go overboard than underboard. All right. Assuming I don't see any other discussion on this.
I have one other point of discussion. We're still at COVID safety
Yep.
measures, correct?
Mhm.
A while back, we talked in this COVID safety measures. Marty, you had said there's an academic coalition type group that you're having collect data at the schools. I just want to make sure, is the school committee aware of this?
Well, I haven't started any of the coordination for that. I have to get a finalized agreement first. This is things that are in the works.
Oh, this is just a plan you have for now. You
They
don't-
are coming on board to do contact and outreach for our non-English language speakers and for some data analytics. And one of the data analytics I would like them to work on is the test and stay metrics. I will
Okay.
work that out with the school nurse and superintendents.
And school committee would have part in that.
I don't have anything to do with the school committee. I will work it out with the school nurses and with the school superintendents, and then they will work it out with the school committee if there's something that is a concern.
Okay.
Anything further on this topic?
Nope.
Seeing none, we can move on to our last agenda item, which are approving the minutes of September 20th, October 4th, October 18th, November 1st, November 15th, December 6th, and December 20th. I know we're really quick to sometimes make a motion and blanket approve these. I was reading through some of these, and I see some major errors in who was speaking, things like that. I think rather than personally, I'd rather than take a vote on approving those minutes tonight, that one of us, and I don't mind going into the office and working on it just with Cassie and just fixing some of that wording. There's just in every single one, there's something. I just want to make sure that those get taken care of. I'm happy to give examples, but
I have
Aaron,
comments for a few, Aaron, but I also want to say in the open meeting law, we're supposed to get these approved within 30 days. Unless there's a significant reason why we can't. And I understand we're all dealing with COVID, but is there a significant reason why we're this far behind the 30-day regulation?
There was a staffing issue at town hall for a while, which is why they weren't done. That's been my understanding the entire time. Some of these have been done for at least a month or so, and we couldn't get to them last meeting, so that's why we're doing them now. I'd like to get them done, approved as soon as possible, but I also don't want to approve incorrect minutes. So I think if they're coming to us, take care of this now, we should.
Is this something we should be taking on as a board so that to alleviate the health department staff of this duty?
That's a question for the health department, but I don't think it's a precedent that any other board has that, I mean, other than appointed boards, maybe that their board members are taking their own minutes. When it's one
We
of
have
the
the staff
members.
that can support the minutes now. It shouldn't be an issue going forward.
Thank you.
I have no problem if
Barring COVID, illnesses and those kind of things.
because we could sit there and pass the minutes as amended, but we're gonna have to go through every single one of them right now, and that's what I don't know if that's worth our time, rather than just having them fixed and coming to us and have minor errors rather than these major who was speaking at what time errors without going back and actually watching the meeting. I mean, I will do, obviously, we will do whatever the board wants. That's my concern.
Aaron, I just have a few changes. I can forward an email to you with the changes that I have noticed, and changes that needed to take place in the minutes. I can do that.
Christina?
Is that something that we can, agree upon here now that, here it's written that Aaron said this, Kevin actually said it. Are we able to agree to those changes and vote on the minutes to approve with those changes involved? Like,
I mean, I suppose we can take that sort of a motion or approve it that way. I also don't want us to approve something that isn't complete either. I'm trying to do this in the most, we actually see the thing that is going to end up in public record, not we just approve what we assume is going to be fine and then it goes out.
I agree with Aaron. I'd like to see a full review of the minutes before we vote on them, if Aaron is concerned, especially as the chair. There are two notes I just wanted to bring up. One was On the November 15th meeting and the review of the fee schedule, this wasn't noted that I asked if Marty Golightly had any recommendations or requested the board for changes, to which he said no. The other one was in the 12:06 minutes. It noted that Elijah Chris spoke, but there was no record of his statement. Thank you.
Make note of that as well. And I think the biggest changes that I would want to make seen done, obviously, are there's times where it says Kevin's talking, but it's actually me, or vice versa, you know, where the two male members get confused, or Christina and Melissa, or it says people were there that weren't there. Like I think it says Melissa was at a meeting she wasn't, or things like that. I want to make sure those are correct before we go through these, because we're going to sit here for probably another 20 minutes, 30 minutes trying to go through every single detail.
My couple of 2 cents on here is the November 15th. You know, it's the adjournment of the meeting. It says seconded by Mr. Andrew, not Mr. King. Then at the top, you know, members present, and I'm not even in there.
Right.
I did not get to the other ones. I was going to bring them up as we went along. But for the Monday, November 1st minutes, Monday, October 18th minutes, and Monday, October 4th minutes, I'm going to have to not vote on, as I was not a member of the board yet. So I don't feel I have any reason to vote on anything on those 3 meetings.
Christina, I believe you had something you wanted to say.
Question for Marty, and this is really about like what the health department's logistics are like. Would it be possible for like a long-term plan that each board meeting that we have, we're always approving the former minutes so that we're doing them like as we go instead of in bulk? Would that be something we could try rolling out?
Barring any problems getting the minutes done in the 2 weeks, I don't think it should be a problem.
Okay, so maybe in our
We've
next
tried
meeting,
that, been pretty successful with that in the past, but
staffing and everything in
Yeah.
this last couple of years has been.
I put out the request for these minutes for some time, and I know there's been staffing issues, which is why they haven't made out. So I've been trying to be understanding of that, and that may not have been communicated that there were those staffing issues, but I'd like to, if possible, I'll do this. I'll make a motion that we table the discussion of these minutes, barring changes, to our next meeting, and we will vote on them then. So that's my motion, that we table this. Do I have a second?
Second.
Second. Oh, Kevin's box lit up, so Kevin, second from that. So assuming this motion passes, we'll get those done, and we have the staffing now. We'll try and get these the previous minutes just every meeting going forward. Christina.
Question for discussion to you, Aaron. So we're not like violating open meeting law. Is the proper like procedure, if I get the minutes and I notice there's changes, I go right back to do I like send that through email to the person that is documenting the meetings before it comes to the board? Or what's the best way to do it?
I personally don't think there's an issue if there's something, whereas, I should have said that I said something or something like that. If we want to send that directly to the person that was making them, we can change the who was saying what, because obviously that's fact, that's what it is. If it's the wording on how something is in the meeting, whether it's content wise, that needs to be a discussion for the board. But if it's something as basic as we're looking at the YouTube video and that was written down wrong, as I said something versus Kevin, then I think that's a different story. But the right thing would be to bring it up to everybody. And I only noticed this looking at it today, so this is why I'm bringing it up now that we take care of it.
Okay, thank you so much. I know this wasn't relevant to the vote, but sometimes I feel if we don't do the discussion before the vote, the topic has moved on. So thank you, John.
Any further discussion before we take a vote on this? And Andrew, since we're taking a vote on all of them, you can vote on this if you'd like. So we could do a roll call. Melissa?
Sorry, yes.
Christina?
Yes.
Kevin?
Yes.
Andrew?
No.
No. And I, okay, sorry, I was looking at me and then nothing was said for me. right, so the motion passes. We will vote on these at our next meeting after those changes are made. I believe that is all of our agenda items for tonight. I would now entertain a motion to adjourn.
Motion to
Motion.
adjourn.
Second,
A motion to adjourn from Melissa, second from Kevin. This is roll call vote. Melissa,
Yes.
Christina, Kevin,
yes.
Andrew,
Yep.
and I vote yes. The motion passes unanimously. We are adjourned.